Hi, Dr. Goodwin. Oh,
How
hi,
are you?
Goodwin.
Yes, how are you both?
Wonderful. Doing very well.
Very good. Well, I think we're going to talk about heart. In fact, I shouldn't say I think. We're going to be talking about heart disease today, and especially how it affects African Americans who have an increased risk of heart disease. And first, let me just introduce the two of you to my Health Power audience. Dr. Eldred Lewis from Brigham and Women's Hospital, and also Associate Professor of Medicine at Harvard Medical School, correct?
That's correct, Dr. Goodwin.
And then Robert Epps, who's a retired Coast Guard officer who, in fact, has had heart valve disease.
That's correct, Dr. Goodwin.
Okay, so let's get started. As I say, African Americans have a higher risk of heart disease. Doctor, could you tell us what the Heart Valve Ambassador Program is about?
Yes, it's a program that was created by the American Heart Association to really put a group of volunteers together who have lived through and survived heart valve disease, but also they're caregivers as well. They're leaders in their community, and they work to raise awareness about heart disease, but also they kind of work to specifically raise awareness and provide helpful information and resources about heart valve disease.
Now,
because they've survived... Oh, go ahead.
No, you go on. Go on. I'm sorry.
Oh, I was going to say, because they've actually survived heart valve disease, they're really the perfect group of people who can explain what it's like to live with heart valve disease, some of the physical demands that people may have, and some of the concerns that people may have, and emotional concerns, as well as some of the anxiety and uncertainties about what the future may entail. And even though doctors can share exact information about what these diseases are and what causes them, these ambassadors can provide personal experiences and their journey, which can be incredibly helpful for people who are struggling emotionally and struggling with the fears of this new diagnosis of heart valve disease.
Could we also call it sort of a peer support program?
Absolutely. It's an ultimate peer support program.
Okay, that's good. Now, let me ask you this. I know that heart disease is the number one killer in the country, period. And then, of course, that African Americans have an increased risk. But could you clarify the incidence, the difference in likelihood of heart valve disease versus coronary artery disease?
Well, in general, coronary heart disease encompasses a lot of the diseases that may affect the heart and the blood vessels, and that can be prevalent. But in heart valve disease, it's actually a group of conditions that can affect all four of the valves, as you know. And patients can be at risk for these, but even patients without traditional risk factors can actually develop heart valve disease as well. When we think of heart disease in general, it does affect so many people. And even just between 2011 and 2013, about 170, the death rate among all people was about 170 per 100,000 from heart disease.
Okay, and just as a general thing, this is my doctor wanting to know: is heart valve disease nearly as common as coronary artery disease, or half as common, or what?
Well, we're really focusing on heart valve disease today, but if you look at coronary heart disease, it's more common. But if you look at heart valve disease, there are 5 million people a year who will develop heart valve disease during each year. So the risk is really quite high.
Okay. And who's the greatest risk for heart valve disease?
Well, anyone can be affected, but the people at greatest risk are older populations, people who've had pre-existing heart disease, such as heart failure or heart attacks, and also people who are born with certain diseases as well, such as congenital birth defects that can affect the valve, or people with certain conditions such as Marfan syndrome.
I see. Now, Robert, I didn't forget you. I really want you to tell us about your personal journey with heart valve disease.
Well, Dr. Go and I had a benign heart murmur as a teenager. The symptoms started to appear at age 31. I was feeling somewhat tired. I presented with the doc was just doing some vitals on me. She heard I had regurgitation, and come to find out it was severe regurgitation. I had an aortic dissection. I had an aneurysm in my ascending aorta that was 8 centimeters. So I had to have surgery for that. Once I had the surgery for that, a few years later, I had another surgery to repair the rest of the dissection in my aorta and the rest of the aneurysm. And because of that, it's a mental struggle, to say the least, and it's a psychological battle as much as a physical battle. But to get around a lot of those challenges, I started public speaking about it and sharing my story, and that's why I became a heart valve ambassador with the American Heart Association.
So basically, you're an advocate for understanding about heart valve disease and helping people to learn how to live well with it.
That's correct.
Okay, that's very good. And of course, you retired from the Coast Guard.
That's correct, Doctor.
Okay, well, let me congratulate you on having been with the Coast Guard, even though you're not with it anymore. What, Doctor, would you say we want people to learn more? Well, let me ask Robert first. When you're doing your advocacy, what are the most important things you want people to know who have heart valve disease?
Well, we want them to know that they're not alone. There are many online resources at heart.org/heart valve. That's the American
Okay, slow down. Let's slow down and be sure the audience gets it. Where's the location for information?
It's heart.org.
Heart.org.
Heart.org/heart valves.
/heart valve?
Mm-hmm.
Is that an S on valve or no?
Yes.
Valve. Okay. Heart.org/heart valves.
Mm-hmm.
Okay, now you can continue. I just wanted to be sure we shared that information with our audience.
Oh, I'm sorry about that, but yeah, they can go there. There's a copious amount of information regarding whether it's pre-op or post-op. They can get support, talk to people who have gone through the surgery, and the information there is like I said, it's a bunch of information there, and just the fact that you can talk to people, because 20 years ago next month I had my surgery and nothing like this was available. So I would say take advantage of that resource and get in there and get online and see what the resources that are available and the contacts that are available for those people.
Okay, and Dr. Lewis, what would you say is the most important message we want to leave with the audience?
I think the most important message is that that many people can be at risk even when they don't have traditional risk factors for heart disease in general, and that they can have symptoms which can be very slow in onset, such as shortness of breath, chest pain, dizziness, fainting, as well as even swelling in the legs. And although these symptoms and signs can due to other things. It could also be due to heart valve disease. The only way to really know that you have heart valve disease is to go see a doctor and have the physical examination, and then also do the necessary tests that the doctors will do, typically an ultrasound or an echocardiogram, to try to specifically look at the valve to see if it's a valve problem, and if so, how severe it is. The last thing I would want to stress is just because someone has a valve problem doesn't mean that they're destined to have surgery, or need a procedure. In fact, there's many people who have heart valve disease, and it's relatively harmless, and they'll live with it and have a normal life expectancy, just kind of checking in with their doctors periodically to make sure it's okay. But it's hard for a person to know whether or not they have the one that's going to progress or not without basically monitoring it on a regular basis.
And for some of those who have, I would have thought surgery might have been often necessary, but if they don't require surgery, what do they usually have, medication?
Exactly. So some people develop, although many people may not have any risk factors for heart valve disease, there are some people who may have things such as heart attacks or high blood pressure or even heart failure, and by taking their medicines to control those things, they can actually prevent their valve problem from getting worse. And that's why it's so important, because if someone has high blood pressure, which is so prevalent in the African American community, and their blood pressure is uncontrolled, then over time their valve can actually get progressively worse. So by treating the underlying problem, it may prevent them ever needing a surgery or a procedure.
Well, it's certainly good talking to both of you. I might want to be back in touch with you to see if we can put a blog or something concerning your experiences on the Health Power website.
We'll be happy to help.
Okay. Yes. So have a good day, and I'm very glad to have had a chance to share this information with the Health Power audience.
Well, thank you, Dr. Goodwin. It's a pleasure talking with you.
Okay. Have a good day.